Hi, this is Group 1, and we're going to be presenting Space Medicine, the Final Frontier. So what is space medicine? Space medicine is the practice of medicine on astronauts in outer space. Its objective is to investigate how long and how well humans can survive in extreme conditions in space. How fast can returning space explorers adapt to Earth's environment after returning from their voyage? Some history and some fun facts related to space medicine and how it has affected our lives previously. The term space medicine was coined in 1948 by Herbertus Strughold, a former Nazi physician who was brought over to the U.S. When President Kennedy committed to going to the moon in 1961, nothing was known about how space affects the body. Joseph Kerwin was the first physician to fly in space on the first Skylab mission in 1973. And digital mammography is a direct application of space data reduction process. And baby foods that we have today are more helpful because of astronaut food research.
Next, we're going to discuss the current condition of space medicine. So how is the body different in space? According to an article in Time magazine, many changes occur to the body while in space due to microgravity. Organs are no longer located in the predictable position that they were found on Earth. This can be significant when performing EKG since the heart is shifted out of place. Organ shifting can cause compression of other organs as well. Without resistance, the skeletal system begins to weaken and decalcify. Astronauts can delay this process by exercising regularly in space. Vision is also affected by microgravity. Fluid moves from the lower body towards the head where it can compress the optic nerve and change the shape of the eyeball. Additionally, eye infections are prevalent because dust and bacteria no longer settle on the surface of objects, but instead remain in the air. Calluses normally form to protect the feet from constant weight bearing. However, with microgravity, callus formation is not needed, actually leading to sloughing of calluses. Intestinal motility is decreased without the force of gravity to help propel food through the gastrointestinal tract. And additionally, stitches are no longer sterile in space because they do not remain in one location and tend to float through the air. Space does not allow for the development of sterile fields for operations. Multiple studies have found that astronauts are more susceptible to a few specific medical conditions. According to the Western Journal of Medicine, the takeoff itself can be very difficult on the human body. Originally, launch vehicles reached forces of 7 Gs, which is 7 times the force of the Earth's gravity. The final velocity during launch reaches a speed of greater than 25,000 miles per hour. This can lead to chest pain and decreased respirations for the astronauts due to the force of the chest wall on the thoracic internal organs. Moreover, space motion sickness is typical when the shuttle reaches orbit. Symptoms include motion sensitivity, malaise, lethargia, vomiting, and loss of bowel sounds. Usually these symptoms resolve on their own within 6 days, and the cause is unknown at this time. Muscle force needed to move the body is drastically reduced while in space. This leads to muscle atrophy. Astronauts can prevent this by wearing a penguin suit. It mimics the force of Earth's gravity by applying a force on the body into the fetal position to increase the force required for the muscles to move. Muscle atrophy can lead to further kidney problems due to increased excretion of nitrogen. Similarly, the bone resorption occurs without use of the skeletal system. Due to weightlessness, the venous pressure throughout the body is equalized and normal physiological hydrostatic pressure is altered. This can lead to increased fluid loss during the first few days in orbit. Radiation exposure is greatly increased in space. The cosmic rays and the charged particles from the sun are normally blocked by the Earth's atmosphere. This can lead to acute effects on the body such as nausea, vomiting, decrease in hematopoiesis and infection, and the long-term effects include increased risk of genetic mutation, cataract formation, and decreased life expectancy. According to the Scientific American Journal, there have been no physiological emergencies in space. However, astronauts can experience increased stress, anxiety, and depression while in space, leading to further behavioral problems. Many of those that go on space missions undergo strenuous physiological or psychological screenings before selections.
Some equipment used in space includes defibrillators and EKGs. However, the most common diagnostic tool used in space is ultrasound. This is because ultrasound is compact, lightweight, cost-effective, and versatile. If necessary, it can be used by crew members with instruction and analysis from ground. Ultrasound can be used to perform cardiothoracic scans, abdominal scans, dental scans, and bone scans. It is interesting to note that ultrasound can, in some ways, work better in space than on Earth. This is because in low gravity scenarios, organs move closer together, preventing distortion that normally occurs between organs. X-rays, CAT scans, MRIs are not utilized in space due to their size and radiation. A space linear acceleration measurement device is used to measure body mass in low gravity. It does so by exerting a force generated by springs against a crew member and measuring the resulting acceleration of the crew member. The mass of the crew member can be calculated by dividing the force exerted by the acceleration measured. A combined operational load-bearing external resistance treadmill is used to provide crew members exercise in an effort to prevent bone and muscle degeneration and provide cardiovascular conditioning. Colbert also collects data and sends it to Earth for analysis. NASA has utilized a Robonaut, a dexterous humanoid robot, to assist crew members with tedious tasks inside and out of the International Space Station. The Robonaut 2 is undergoing training to perform telemedicine such as ultrasounds and injections, and it is believed that in the future, the Robonaut 2 will be trained to perform surgeries led by physicians on Earth. We are currently prepared to treat severe allergic reactions, seizures, difficulty breathing, nerve blocks, temporary dental filling, dental crown replacements, dental pulp exposures, standard ALS treatments, and many others.
As far as medications available in space, there's actually only 26 different ones available, including bacitracin, Imodium, a variety of different antihistamines and decongestants, as well as lubricating eye drops, Tylenol, aspirin, Motrin, various sleep aids to help the astronauts sleep, as well as steroids, stimulants, and stool softener. The medical kit that is available to them also contains 3 different emergency drugs: epinephrine, atropine, and lidocaine. And pharmacokinetic data is a topic of ongoing research for the astronauts. Things like altered metabolism of enzymes, kidney function, decreased total blood volume, and differences in organ perfusion, as well as altered gastric emptying are all common in astronauts that affect the way pharmaceuticals are metabolized. And more recent research is currently under development on drug efficacy and formulation stability while in space. As far as emergencies in space go, to date there's never been a major medical emergency on the ISS. The most severe cases they've seen are arrhythmias, renal colic, choking, and infection. Some infections may be difficult to treat up in space because within the last year, it was discovered that certain bacteria are more resistant to antibiotics in space. Other conditions that are typically seen: motion sickness, headaches, sleeplessness, back pain, skin conditions, trauma and burns, as well as dental emergencies. The medical kit available to them only consists of a basic first aid kit, defibrillator, portable ultrasound, ophthalmoscope, and only 2 liters of saline. And as was stated before, the ultrasound is used as their main diagnostic tool. These ultrasound images are often interpreted in real time, and the astronauts are also constantly monitored for things like sleep, diet, and exercise on the ground. But emergent care is oftentimes very difficult with the limited resources they have. They do have a Russian Soyuz capsule on the ISS that's reserved as a dedicated ambulance that can be used as a return to Earth within 24 hours. One of these emergencies that is possible in space is CPR. Obviously, astronauts are usually very healthy, but there's always the risk of cardiac arrest in space requiring CPR. There's currently 5 known techniques to perform CPR in microgravity, which are listed above. And in 2013, the guidelines for CPR changed to initiate compressions on a patient in cardiac arrest first, rather than clearing the airway, due to the research found in the importance of compressions. And so all these techniques focus on maintaining the best compressions possible for the astronaut. Following a retrospective study on CPR techniques, the handstand technique was found to be the most effective in providing chest compressions in microgravity, followed by the Evitz-Rossellano technique, and those are pictured there.
Okay, so how does space medicine affect us common Earthlings? So they've done research, and we've learned a lot on how to prevent bone mass loss in space, which could help with therapies for osteoporosis. Technology called retinal descensometer was also used to detect faint light from distant galaxies, and this is now used to diagnose age-related macular degeneration, which is the most common cause of vision loss. Measuring nitric oxide levels that are released by inflamed areas helps space physicians determine if an astronaut has an infection, and the same can be applied to asthmatics, who can use the same device to measure their nitric oxide output and predict if they will have an oncoming asthma attack. Currently on the ISS, they are working on developing salmonella vaccines and are also studying MRSA to try to find a vaccine for the infection. Stress associated with spaceflight can cause weakened immune system, and that reactivates the viruses that cause shingles. And NASA has developed a PCR technology that looks for some of the biomarkers of shingles so that preventative measures can be taken before the disease develops. And as for cancer treatments, oncologists currently use a microencapsulation approach to treat cancer. And microcapsules are little balloons filled with a mixture of drugs that will be targeted to the tumor. And on the ISS, they have developed new processing systems for microcapsules that allow for modified fluid mechanics so that more fluids can be placed in the microcapsules, providing less risk for contamination. And so how do we manage care in space? Previously, astronauts had to receive all their medical training prior to space missions, limiting how much could be learned, as well as limiting sort of the treatment ideas and information they could receive before launching up. Space crew members can currently stay up to date with the latest knowledge of medical treatment, as well as policies and procedures using advances in telemedicine. And they can update medical procedures, algorithms, medical kits sort of on the fly as policies change on the ground. And for a while, this was sufficient for foreseeable emergencies, but not quite for novel emergencies that weren't planned for.
All right, and now we're going to go into a little bit more detail about telemedicine in space. So telemedicine in space is a relatively recent innovation and usage of telemedicine, and it's beneficial for short-range space missions such as to the moon or the International Space Station, and generally those of shorter duration, about 6 months to a year out in space. And with astronauts and space crew members, they generally receive their training before missions on how to use diagnostic equipment and different techniques such as ultrasound, and how to perform simple procedures that are likely to be encountered during spaceflight. Telemedicine allows them to liaison with medical professionals on the ground and how to best approach medical issues and emergencies that were not planned for. Telemedicine definitely plays a large part of the medical support team. And without a doubt, a great deal of planning goes into every space mission. There's dedicated teams, medical teams consisting of NASA's ground medical personnel, which includes physicians, biomedical engineers, nurses, imaging specialists, and even psychologists. The medical team determines what tangible and intangible assets are needed for each mission. Examples of tangible assets are physical items such as medicine, instruments, consumable items such as food and exercise equipment. Intangible assets are basically the intellectual property, medical expertise on board and on the ground. This includes processes, procedures, and protocols that need to be followed as well. Telemedicine is useful because it bridges all these aspects and brings them together through a communication system that can transmit and share medical data and info in both directions. Telemedicine is certainly useful for rapid communication and learning. Space crew members can receive new medical information quickly and efficiently. This can assist crew members in following up with a physician on the ground following a medical emergency. You can also share diagnostic images such as ultrasound with radiologists and ultrasound specialists to diagnose medical issues that arise in space that were unforeseen, such as knee pain from zero microgravity, as well as gallstones. Unfortunately, with all types of technology, there are limits of using telemedicine in space. While telemedicine is great for short duration and short distance space missions, There are limitations on longer duration flights as well as exploration missions to further targets such as Mars and beyond, where there is a great distance between the spacecraft and mission control. This is due to information and data taking too long to be transmitted back and forth from the spacecraft and ground control. And because of that, there is a time lag, so it wouldn't be useful in emergencies. Further missions, such as to Mars and beyond, may need the assistance of quantum computing, artificial intelligence, and even virtual interface software.
So now we're going to talk about how exactly one can get into space medicine. So there are 5 accredited U.S. residency programs. One is at the Wright-Patterson Air Force Base and then at the Naval Aerospace Medical Institute, and those are both through the military. There are 3 civilian programs at Wright State University, the University of Texas Medical Branch, and the Mayo Clinic. When you apply for these residency programs, they want to see that you have a substantial clinical background, so most people who apply often have worked in the clinic for a few years before. They also want to see that you have training in multiple disciplines. NASA has opened up a 4th-year clerkship, and currently there are only 6 spots, and it's pretty competitive. There's a lengthy application. You need to submit a personal statement, your CV, and a letter from the dean. But there are more spots opening up. I talked about how you want to have a lot of different specialties training. So these are some of the specialties that you can train in: preventative medicine, internal medicine, family medicine, emergency medicine, ophthalmology, otolaryngology, and psychology. NASA has implemented a physicians compatibility program that encourages agencies to provide allowances for federal physicians who enter into a service agreement with the agencies. This was started to improve recruitment and retention problems. According to NASA, the PCA is critical for recruiting physicians since the salaries are consistently lower than the private sector. The overall average physician pay for 2016 was $179,670. $19,194 was attributed to the PCA funding on average. Physicians had multiple different job titles within NASA, including clinical positions, occupational health, and health administration. All of the clinical positions were located in Houston, Texas, with a focus on the International Space Station crew. The clinical positions operate 24/7 and support the active members of the astronaut corps as well as retired astronauts. These physicians also work to develop recruitments for the Commercial Crew Program and the Orion spacecraft program. The single occupational health physician was located in Washington, D.C. This physician's compensation was much higher than the clinical positions due to location and competition from other federal agencies.